Lecture, Chapter 3, Moral Norms. Good day, everyone. In our last sessions, we explored the ethical principles that guide clinical behavior and the major theories, utilitarianism, deontology, virtue ethics, and others that help us decide what is right or wrong. Today, we shift from theory to the norms, the rules, standards, and expectations that shape actual behavior in both personal and professional moral life. Chapter 3 of Basic Ethics dives deep into the concept of moral norms, those invisible yet powerful guides that help us discern how to live ethically in everyday life. This is especially relevant in healthcare, where decisions can mean the difference between life and death, trust and betrayal, healing and harm. So what are moral norms? What are moral norms? Moral norms are standards of behavior that are widely accepted as guiding how people ought to act. Unlike laws, which are written and enforced by institutions, moral norms often emerge organically from society, religion, culture, or professional communities. They aren't necessarily enforced by police or courts, but they do have consequences. Violating a moral norm might not get you arrested, but it might cost you your job, your reputation, or your peace of mind. In healthcare, moral norms are crucial. They guide how professionals interact with patients, families, and colleagues, whether that's respecting confidentiality, telling the truth, advocating for the vulnerable, or maintaining boundaries. Now let's distinguish between two categories: descriptive norms and prescriptive norms. Descriptive versus prescriptive norms. Descriptive norms tell us what people actually do. These are based on observation. For example, most people avoid telling terminally ill patients the full truth about their prognosis. But just because something is commonly done doesn't make it right. That's where prescriptive norms come in. Prescriptive norms say what people ought to do. They are grounded in ethical reasoning. We ought to tell the truth to patients even when it's hard, because truth respects their autonomy. Ethics is ultimately about prescriptive norms. Our task isn't just to describe behavior, it's to evaluate and shape it. Features of moral norms. Dr. Cohen identifies 5 key features of moral norms that distinguish them from other kinds of social rules: normative dominance, universality, impartiality, reasonableness, overridingness. Let's go through each one. 1. Normative dominance. Moral norms override other types of norms when they come into conflict. For example, imagine a hospital administrator says, "We can't afford to give this life-saving treatment because it's too expensive." That's a financial norm, but a nurse might push back saying, "But we have a duty to save this patient's life." That's a moral norm. In most ethical systems, moral norms dominate. They take precedence when values collide. This is why healthcare ethics committees exist, to remind institutions that morality isn't just one voice in the room, it's the loudest and most binding. 2. Universality. Moral norms apply to everyone in similar situations. If it's wrong for one nurse to falsify medical records, it's wrong for all nurses. This doesn't mean we ignore context, but it does mean we seek consistency. Ethics is not a game of favorites. This is particularly important in multicultural healthcare settings. Universality doesn't erase cultural difference, but it affirms that some principles, like honesty, respect, and human dignity, transcend borders. 3. Impartiality. Impartiality demands that we treat all moral agents equally, unless there's a morally relevant difference. In a triage situation, if 2 patients have the same medical needs, we should not prioritize one over the other because of their race, religion, income, or social status. Our choices must be fair. This is one of the most challenging aspects of moral life, because human beings are not naturally impartial. We favor friends, family, people who look like us or agree with us. But ethics calls us to rise above those instincts. 4. Reasonableness. Moral norms must be rationally defensible. That means they are not based on blind authority, gut feelings, or power dynamics. Instead, they are grounded in reasons that can be explained, understood, and debated. In healthcare ethics, this is vital. You may feel deeply that euthanasia is wrong, or that it is compassionate, but ethical justification requires more than feelings. You must offer reasons that others can evaluate. This is what separates moral reflection from moral absolutism or fanaticism. 5. Overridingness. This is similar to normative dominance, but with an even stronger emphasis. Moral norms are binding and cannot be dismissed just because they are inconvenient or unpopular. Consider a situation where a hospital policy encourages early discharge to reduce costs, but a physician believes the patient is not ready. A strong moral norm, do no harm, may override the policy. Overridingness affirms that when push comes to shove, moral obligations must take precedence. Types of moral norms. The chapter goes on to break moral norms into different types. These help us see how ethics operates on different levels. Let's explore principles, rules, rights. Virtues. 1. Moral principles. These are broad moral statements like do no harm, respect autonomy, protect the vulnerable. Principles are foundational. They often serve as the backbone of professional codes of ethics. Think of them as moral North Stars. They don't give specific answers, but they guide the direction of ethical decision-making. In practice, we sometimes need to balance conflicting principles. For instance, a patient may refuse treatment, autonomy, but their choice may lead to harm, non-maleficence. In such cases, ethical discernment is needed. 2. Moral rules. Rules are more specific than principles. They often derive from principles and provide concrete guidance. Do not lie to patients. Always obtain informed consent before treatment. Maintain patient confidentiality. Moral rules are enforceable. In fact, they often overlap with legal rules, but not always. Some rules are moral without being codified in law, and some legal rules may lack moral authority. The strength of rules is that they offer clarity. The challenge is that they can become rigid or fail to account for complex cases. 3. Rights. Rights are moral or legal entitlements. A right always implies a correlative duty. If I have a right to clean water, someone has a duty to provide or protect that access. In healthcare, patients have rights to informed consent, privacy, timely and appropriate care. Access to records rights empower individuals and protect the vulnerable. They prevent people from being reduced to mere tools or statistics. However, rights can also conflict. For example, one patient's right to aggressive treatment may compete with another's access to limited resources. Ethics helps us resolve such conflicts with fairness and reason. 4. Virtues. Virtues are character traits that support moral living: honesty, compassion, courage, patience. Whereas rules tell you what to do, virtues shape who you are. A virtuous caregiver does not need constant rules. They intuitively know how to respond with integrity. But virtue ethics requires formation. You don't become virtuous overnight. It's a lifelong process shaped by community, mentorship, and reflection. Conflict of norms. Moral life often involves tensions. What happens when principles collide? Imagine this. A suicidal patient refuses treatment. Autonomy. The nurse wants to intervene to save them. Beneficence. What takes priority? Or another, a physician discovers a genetic condition in a patient that could affect the patient's sibling, but the patient insists on confidentiality. Does the physician protect privacy, confidentiality, or warn the sibling, justice? These real-world conflicts show that ethics is not always a clear checklist. It's about discernment, often guided by consultation, policy, personal conscience, and dialogue, moral obligations, and ideals. One last distinction in this chapter is between obligations and ideals. Moral obligations are duties we must fulfill. Failing to do so is wrong. Moral ideals are acts of moral excellence, not required, but admirable. For instance, a physician is obligated to provide competent care, but a physician who visits a dying patient on their day off goes beyond obligation. They demonstrate a moral ideal. Ideals inspire us. They remind us that morality isn't just about avoiding harm or checking boxes, it's about becoming our best selves. In healthcare, this might mean staying late to comfort a grieving family, going out of your way to advocate for a vulnerable patient, forgiving a colleague who made a mistake. These are the acts that create moral culture, that build trust and shape the soul of a profession. Conclusion: the moral landscape. So, what do we take away from this chapter? Ethics is not just about what we believe, it's about how we live, and how we treat others when no one is watching. Moral norms give shape to that life. They help us think clearly in chaos, act consistently across situations, respect the dignity of each person, protect the vulnerable, and challenge injustice. In the world of healthcare, moral norms are not optional, they are essential. They are the invisible infrastructure of compassionate, competent care. As we move forward in this course, I invite you to reflect. Which moral norms resonate most with your experience? Where do you see them honored, and where do you see them neglected? How can you embody moral ideals, not just fulfill obligations? Because ethics isn't just about knowing what's right. It's about becoming the kind of person who does what's right. Thank you.